All right, good afternoon. I'm Curry Mayer, and I am the moderator for today's forum. I'm also in charge of emergency management for the city of Bellevue, Washington. I'm so glad that all of you were able to join us for today's forum. Our focus today is recovery and resilience in the era of COVID-19 and the interconnectedness of sectors. I've heard it said that we should never waste a good disaster, that there are always things that we can learn from thriving in chaos. And while many of us would most likely agree that a pandemic was not the disruption or the large disaster that we were all anticipating or planning for, it has provided us with some opportunities to look at new ways to stay connected regardless of the situation, and do that while adapting to a new environment. Disruption, which I am in favor of, is often the catalyst for innovation. So you will hear from our panelists what has changed for them, what new connections they have made, and what are the positive outcomes they've discovered while working in this environment. So the format for today's session will be that we'll start with some prepared questions. We'll give each of the panelists an opportunity to answer a question before hearing from participants. So if you would like to ask a question, if you will please type it in the chat box, and we will be keeping track of those questions, and we will do our best to hear from all of those who wish to participate. So first of all, we'll start out with having the panelists briefly introduce themselves one at a time. They're much better at telling you about them than I would be. So we'll start with Carla Selp from the Washington State Department of Agriculture. Carla?
Good afternoon, everyone. My name is Carla Selp. I'm a public engagement specialist with the Washington State Department of Agriculture. And as you can imagine, with the Department of Agriculture, we're kind of a small communications shop, so we all wear a lot of hats. One of my hats is working on basically all communications related issues with our Plant Protection Division, which includes the pest program and topics like gypsy moth and the now infamous Asian giant hornet, or as you may have heard, murder hornet. That's the last time I'm going to say that today. I also do a lot of other things, have a lot of other hats. One of them is to run the social media for the Washington State Department of Agriculture. We have about 40,000 followers on Facebook, which is our primary platform. And that's not, a ton in, as far as major brands go, but for a state agency, especially to do with agriculture, that's pretty good, I think. Another hat that I wear is I am the emergency response PIO. So I've gone through a lot of the trainings, the basic and the advanced PIO classes with FEMA, as well as a lot of other trainings. And I also do the emergency exercises at Hanford for Department of Agriculture's role. So that's some of the work that I also do photography and video for the agency. So wow. That's me.
Great, thank you. Thanks for joining us. Megan DeBolt is from Walla Walla County Department of Community Health. Megan?
Yeah, good afternoon. I'm Megan DeBolt, and I am the director of Walla Walla County Department of Community Health, which is a public health and human services department, and we serve all of Walla Walla County, including the incorporated cities.
Okay, thank you. And Sam Cho, who is the Seattle Port Commissioner. Hi, Sam.
Hello, good afternoon, everyone. Sam Cho with the Port of Seattle, elected commissioner back in November of 2019. As you can imagine, it's been an interesting first 6 months on the job, with COVID hitting 3 weeks into my first term. But it's been interesting and in many ways fun, which is a weird thing to say in these times, but the Port of Seattle entails both the seaport, which is what most people traditionally think of a port as, but we also include the SeaTac International Airport. And so we're both in aviation and in maritime. And we're, just to give you a sense of how big our business lines are. The seaport is the third largest cargo container terminal in the country. And the airport before COVID was the eighth largest airport in the country by passenger volume. So we've been seeing hits on both sides, and I'm looking forward to kind of giving you all a lens into what's been going on at the port.
Yeah, we're looking forward to that as well. Thank you. All right, so our first question is, what has changed the most in your work since the pandemic began? And we'll start with Carla.
So before I go into this too far, I just want to clarify that, I'm not speaking for the entire agriculture industry here. There's been obviously a lot of impacts. In fact, Sam can probably talk a lot about those with the ports, but I'm really going to focus on the things that I touch on a lot, which is with, our PUS program, social media, that kind of thing. And so for the Department of Ag, we are considered an essential business because of agriculture and the support that we have for agriculture. So we never shut down at all for COVID. We never reduced staff specifically from COVID. And we've been operating all the way through. The things that have changed are, I'm working from home like almost everyone else, and most people in the office are also working from home unless they have specific equipment that they can't take back to their home, such as our entomology lab, that kind of thing. A lot of us have been able to adapt in one fashion or another. But there are little things you don't think of. For example, we have gypsy moth eradications that we do most years. And this year it was up in Snohomish County where we were conducting two eradications rather. And just the logistics of trying to get a hotel, trying to travel up there, or for meetings that I've been having up in Whatcom County on Asian giant hornet. You don't think, where am I going to stop to use the restroom? That's one little practical thing that we had to, work through because you couldn't just stop anywhere. Now a lot of that has eased up. Traffic has resumed, unfortunately. That was a great change, having zero traffic and making it from Olympia to Bellingham in 2 hours and 15 minutes. That was pretty awesome. But a lot of our work we've had just small tweaks. For myself with social media, there's probably more of an emphasis on social media and also more of an interest from people. I think there's more people at home, more people using social media to connect with others. And so we have had, I think, an uptick, not only because of Asian giant hornet hitting the news, but also just because people are at home using social media more to connect with others. So there's been more engagement there that we've had to manage. And that was a real challenge when Asian giant hornet, hit the national and international news at the beginning of May. As I mentioned, I manage social media as one part of my job, and there was absolutely no way to keep up with the social media interest that started. However, we did have some good, some things set up already to help us succeed in that area, and that I think it was January or February, we had started an Asian giant hornet Facebook group. The Friday before that Asian giant hornet story hit in the New York Times, we had about 1,200 people in that group. Now we have about 5,600 people in that group. So these are people that are really interested in connecting on the Asian giant hornet issue. And because that was already there, we had a place to send them to stay connected and get more information. The other nice thing is that we had a lot of people in that group already who were really educated about Asian giant hornet. And when I was slow to respond to some things because I was just swamped with responding to 150 media inquiries, we had people who knew something, who were just, citizen scientists stepping up and answering people's questions before I could get to them. So it's been different, but more of an emphasis on how we're doing things, obviously more virtually like most people. And for one last example I'll give you is that we had intended to do some trainings for building Asian giant hornet traps for the public in person in Whatcom County, and we have not been able to do that. So we have had, so instead we created a video that showed people how to do it, and all the instructions are posted online, and people are able to answer or ask and have answered a lot of questions in the Facebook group or on the email as well. So I think I'll leave it with that and give some of the other panelists a chance to respond.
Okay, thanks, Carla. Megan, what has changed for you in your
Yeah,
work?
well, I'll echo what Carla, with working from home and definitely a huge uptick in social media and messaging, and then also, that we never closed down. Public health didn't. We were kind of right there on the forefront and the front lines. And I'd say there's a couple of things that have really changed for public health. I mean, we're used to doing communicable disease investigations. That's what we do, and we're used to dealing with special pathogens, and that's what coronavirus is considered a special pathogen. And so, with our first case that showed up at our local hospital, we put in place our special pathogens plans, and we just were rolling, and things have been pretty smooth, I'll say. But I think the main things that have changed for us in public health, at least in Walla Walla County, but I think that a lot of my colleagues around the state would agree, is one is that public health messaging is very difficult, and it often changes when we get new information, to mask or not to mask, to test everyone, to not test everyone. I mean, some of those things have just been so hard, and it's really difficult, that information management piece. And I've heard some people call it, an infodemic, it's like an epidemic of information as well, because there's just so much out there. And I think that, echoing what Carla said, a lot of people are at home, and so they're keeping themselves occupied or connected by Googling a lot of things, and some of the information is great and accurate, and some of it isn't. And so I'll say that's been I mean, we're used to difficult messaging, whether it's HIV or STDs, homelessness. I mean, some of those issues are really difficult to create thoughtful messaging around, but coronavirus has been really difficult, especially due to the political nature of it. The other kind of change, I would say, at least in Walla Walla County, is the role of public health as a, kind of the decision maker. We have a lot of, a lot of businesses, or whether it's the city, cities making policy decisions, to open up playgrounds, or even in the beginning when they were going to close down before there was a official shutdown, was, well, let's call public health. And so on top of, the case investigations and isolation and quarantine planning that we're doing, we're also vetting all these calls from community partners about, what do we do? Should we do this? And could you review our plan? And those things. And so that's been a new role for us. And I think that, we grasp it really well. And we're pretty lucky here in Walla Walla. We've got a great health officer and a great relationship with our county commissioners and our board of health in the cities. But that's definitely been a new role, for public health to be the go-to for pretty much any decision making. I know the governor's going to be on at 2:30 today with new information that, I don't think Secretary Weissman has been, with the governor as much ever in his career as Secretary of Health. And so I think that's been probably the most pivotal, new role for public health with this pandemic.
Thank you, Megan. Sam.
Yeah, well, I think I'll take more of a macro view on this. And as you all probably remember, COVID-19 hit Asia before it hit us. And so as a result of that, we saw the effects of COVID at the port back in late November and December. And that's because Asia shut down in the way that when we shut down in March, Asia had shut down 4 months prior to us, right? China, and the fact that we as a port, our number one trading partner is China. We were disproportionately impacted as a result of China's shutdown than many other areas in the country. The other thing is, you all remember that COVID-19 hit the US in our region first. The first case of COVID-19 hit us, I think it was like January 28th or 27th back, and the individual flew through SeaTac. And he's from Snohomish County, but he flew through SeaTac, came in from Singapore. And so again, we've been dealing, the port has been dealing with COVID. I think we were probably the first touch point. And so what that meant for us was we were scrambling to figure out exactly how we needed to change our protocols and procedures from a safety standpoint, to make sure that we are not basically, facilitators of this pandemic. And for the port, this is a really big challenge because, as you can imagine, there's a lot of players involved. It's not just the port and the State Department of Health. It's the Department of Homeland Security. It's TSA, Customs and Border Patrol, CDC, believe it or not, Fish and Wildlife, right? And so there are so many stakeholders involved, and we work with these stakeholders on a daily basis, but none of those stakeholders are public health agencies. So just to kind of give you an idea of what we've seen at SeaTac, at the height of COVID in March, the number of passengers that got on a plane through security and onto a plane dropped to 2,500 passengers a day. Right now, we're somewhere between 10,000 and 14,000 a day. On a normal day, without COVID, it's 50,000 a day. So we've gone down from 50,000 passengers, and let me make an asterisk here. This does not include people who are connecting flights. This is only people who are getting on a plane from SeaTac. Basically, think of it as people going through TSA, right? People who are getting on connected flights don't even count in this number. And so for us, not only has COVID slowed down travel, but we've had to adapt, right? What are the safety measures? Everything from a face mask requirement at the port, plexiglass, hand sanitizers, temperature screenings. We're working on temperature screenings right now. It's something that you would have thought we would have had back in March, but we're still going through this process of figuring out what temperature screenings look like. And then real quickly, I'll just touch upon maritime, because I told you that we were hit early. The maritime side of things basically had a 25% decrease in cargo. Part of this was because of the trade war with China, but the other part of it was because of COVID-19. And basically what happened was it started in December. We're seeing a 25% decline. The interesting thing is, though, while maritime cargo went down, airline cargo went up. And so that was an interesting development here that we saw. I think it was because we saw a need for PPE from out of the country, and everyone was flying stuff in as fast as they could. So that's just kind of how things have changed for us at the port.
Okay, so Sam, a quick question. What was the relationship with Fish and Wildlife?
Yeah, so Fish and Wildlife is mainly stuff, they do a lot of stuff on international arrivals. So CDC, Fish and Wildlife, and CBP work in tandem for customs clearance and screenings. And so you can imagine people who may be coming from other countries bringing in goods or things that may essentially be carriers of COVID. I think you may have heard some animals have also contracted COVID, and so not something you think about every day, but anything from pets to even literally fish or meat or any other products that people might be bringing in through the port.
Okay, great, thank you. So do we have any questions from participants for this excuse me, first section?
We don't have any yet. If anybody has questions, please feel free to post them in the Q&A or the chat, and we will relay those to Curry for the panelists.
Okay, so we'll move on to the next question is, what is the most unique solution or new way of doing things that you have encountered over the last 4 months? And we'll go backwards and start with you, Sam.
Yeah, so I think for us, the transition and the work with our airline partners to make sure that things are, touchless, right? So, everything from when you check in at the airport to when you go through security to getting on a plane, we want to minimize the number of times you're touching people and you're touching things, right? To minimize the spread of the virus. And so what our airline partners have suggested is that, some of the check-in kiosks you see at the airport have a camera at the top. And so, those cameras have not always been used for, concerns over, privacy, and also, those cameras, the original purpose of the cameras were for facial recognition software, but it's essentially been repurposed so that, in theory, you can hold up your ID to your face and confirm you are actually the person that is getting on a plane, and you are who you say you are. So stuff like that, instead of like touching the screen and checking in with your code, you would just, pull up something on an app, scan it. And so we've been transitioning kind of towards more tech-focused solutions of how to make sure that passengers aren't unnecessarily exposing themselves to the virus or potentially spreading the virus. So that's probably one of the very unique solutions, that we've encountered. And I think in general, it's safe to say that, this virus has kind of accelerated in many ways the adoption of technologies that maybe people would have been wary of otherwise.
Okay, thank you for that. Carla.
So this one was a little bit tough for me. I don't think there's been any, crazy innovative things that we've done. A lot of us have been able to adapt using, virtual meetings and reducing travel significantly. I'll share one unpopular decision that we made, and that is, with our insect trapping that we do. For example, with gypsy moth, we put out over 20,000 traps around the state, and the Department of Agriculture has the authority through state statute to put up traps on private property without your permission. However, in the past, our practice has been that we knock on your door and we try to get your okay before we hang up a trap. This year, because of COVID and not wanting to expose residents or our staff, make our staff become vectors of spreading the disease, we decided we were not going to knock on people's doors and ask their permission, that we were just going to go ahead and hang them, leave information where the public can find it. And this was very unpopular when we put it out there, even though it's exactly what we have the authority to do already in statute. People would rather potentially be exposed to COVID than to have you hang a tiny triangle trap on their property. We found out it was really, we got some serious backlash from that. It didn't stop us. We kept doing it. We're still doing it. That's our practice, but it created quite a bit of work for us, especially on social media, to respond to those inquiries and let people know that this, when the news first went out, a lot of people were, saying, oh, it's more government overreach and more, removing of our rights and that kind of thing because of COVID. It's just an excuse. And so we had to spend a lot of time explaining this isn't a new law. This is the way the law is on the books. We're just being slightly less courteous than we normally are when it comes to hanging these traps. So that's been an interesting change that we've had to incorporate because of the current pandemic.
Yeah, thank you for that, Carla. I've definitely noticed a questioning of who has the authority to tell people or the public to do certain things and whether or not they're going to follow them. Very interesting. All right, Megan, what is the most unique solution for you?
So I'll say that ours is kind of two-pronged here in Walla Walla, you know, beyond our, you know, our actual response to the communicable disease side of the pandemic. Our approach for you know, with our emergency management partners has been critical. And very, very early on, we established a unified command here in Walla Walla County to really, you know, come together and take a unified approach to responding and mitigating the outbreak in Walla Walla County and all of the different tentacles that it has on our community. And so, you know, from Unified Command, we actually, I mean, we have about a 20-something person unified command team who calls in. Originally it was daily, and now we've dialed it back to just twice a week on Mondays and Thursdays. But you know, we have a nice standing agenda where we go over our current disease activity, and we have the hospital call in and our other healthcare partners call in to talk about testing capacity and availability. And then we have our emergency management team and EMS and our county PIO and all the cities, incorporated cities within the county. And so it's been really nice because it keeps everybody on the same page. You know, I think that, you know, piggybacking on what Carla said, you know, it's become a very, you know, it's political, and it's also kind of this governmental front, you know, and having a unified front as well is really critical, so that, you know, our community is, you know, they're dealing with information overload, like I said before, and the more that we can be unified in the information that we're giving out and in our response, and even how, you know, we go about, you know, our approach with our healthcare partners on antibody testing, you know, having our healthcare partners unified on, you know, whether they're going to or not going to provide antibody testing and why to our community has been really critical. And it's really also helped alleviate any, you know, severe community like backlash on us, which has been nice. There's been some, of course, you know, and social media seems to be our worst enemy at times. And so we just really try not to read comments and only respond to the ones that are critical. But from our unified command, we also created a subcommittee that was a reopening work group, and it included partners from the county and our incorporated cities, and then our Chamber of Commerce and our tourism partners, that really looked at how we can include businesses in in the decision making, you know, to reopen and move from phase 1, you know, to phase 2, and then when we decided to apply for a modified phase 3, which then was returned to us because the whole state's on hold. But that's been really great because they, you know, they meet regularly, and we've been involved in several of our Chamber of Commerce's like weekly Zoom calls that they do with all their members, and being able to, you know, answer questions of businesses right there for other businesses to see, you know, because many of the questions from businesses and our community members are very similar. And so that's been, you know, a solution to kind of that information overload to our community, and also inquiry overload to our department, and how we just were having a really hard time responding to all of the inquiries in a timely fashion, and we knew that they were important, and that we wanted to get accurate information out to our community as quickly as possible. And so we were able to use that reopening work group of our unified command to facilitate that, and it's been it's been successful, and they keep going, which is nice. I think they meet every week and talk about, even now, even though tourism is really kind of on hold, with most communities being in a phase 2 or phase 1, with travel being limited to only essential travel or non-essential travel that's kind of approved in certain areas of industry, but travel is happening, and we have a lot of tourists coming to Walla Walla to taste wine, and we just want them to do so safely. We know we're not going to stop them from coming, but we want them to do so safely, and we want them to do so in a way that keeps them protected and it keeps our community protected. And so we were able to partner with like Visit Walla Walla and the Walla Walla Wine Alliance to create kind of like tourist information cards that everybody gets, even at the vacation rentals. Like we've partnered with a lot of the VRBOs and the Airbnbs in the community, because that's usually the first place that somebody goes is where they're going to stay. And so, we have masks for them there and hand sanitizer and this information card on, what our community's pledge to safety is. And so that's been really positive and probably the most unique solution that we've had here in Walla Walla.
Thank you, Megan. And for those of you on who may not be familiar with Unified Command, it is an emergency management organizational structure that's used when 2 or more agencies or disciplines have different authority for an incident and need to work together to ensure the best response to that. So that's awesome, Megan. Thank you for sharing that. Okay, we have a question to all of the panelists from Shane Moore. Have there been many situations that you've had to settle for a less than desirable solution because no unique solution could be practically implemented? And then where do you think the bottlenecks to those situations were? Okay, anybody that wants to chime in?
I can take this one. So this is an excellent question. And, from our standpoint, and I'm sure to many other panelists, the challenge with this pandemic is that, well, it's a pandemic. And for instance, the Port of Seattle is not a healthcare agency. We're not a public health agency in any way. And then the other thing is, the port is very strained in its authority on many things. So, but I mean, I guess this is being recorded, but quite frankly, the questions of, can we actually enforce a face mask policy, right? If someone enters the airport without a face mask and they refuse to wear one, do we actually have the authority to, to detain them or to kick them off the premises? It's very ambiguous. When it comes to things like temperature checking, you would think that taking the temperature of anyone who's getting on the airport on an airplane would be pretty common sense. And granted, a temperature doesn't necessarily mean that you have COVID-19, but it is an indicator that you're probably sick in some way or form. But we don't have the authority, to go up to people and put a temperature screener on their foreheads or have a mass surveillance type camera that has a heat sensor on it. Some folks might think that's search and seizure, and so the question is, who has the authority, and to whom do we need to work with to kind of bring them into the fold and have them do it on our behalf? And then the other question here is, like, let's say you do have a temperature. Do we have the authority to prevent you from getting on a plane when you've legitimately bought a plane ticket? Right? And who can do that? Can the Port of Seattle do that? Technically, we're not the airlines, right? Or is it just the airlines that can refuse a customer service? Or is it TSA? And so when it comes to practical implementation, the question is, there's just kind of been this finger pointing, a lot of finger pointing on, this is your job, this is your job, no, this is your job. And the lack of coordination has been, especially with the federal government, has been a huge challenge for us. And then the legal ambiguity of some of the things that we'd like to do, but aren't sure if we have the legal authority to do, has been also a huge challenge for us. And so I would say those are probably two of the biggest bottlenecks for us as a port is the uncertainty of knowing whether or not we can do this and who should be doing it.
So Sam, do you know, do airlines have the authority to keep somebody from getting on an airplane?
Technically, they do. The airlines, like any business, can refuse service for any reason. However, the airlines don't want to do that, right? Why, if they're a paying customer, they don't want to be the bad guys to say, sorry, you got to get off the plane. And so, there's been push for TSA or some other federal agency to be the bad guys. No one wants to be the bad guy, right? And so, again, it's been kind of like, okay, technically airlines have the authority. They don't want to do it. They want TSA to do it. TSA doesn't think they have the authority. So it's been kind of like this hot potato that's been thrown around.
Yeah, interesting. I think that's come up in a lot of places. Who has the authority to enforce? Thank you for that. Kind of the clash of capitalism and public health.
Absolutely.
Carla or Megan, have you had a situation where you had to settle for a less than desirable solution?
So I have a couple examples. These are both to do with Asian giant hornet, and they're really supply chain issues, in that we have a lot of people participating in our citizen scientist trapping program, as well as we also use a lot of isopropyl alcohol in our working with insects and preserving them and whatnot. And for the public to mail in their samples, they need to include it in a paper towel basically soaked with isopropyl alcohol, so that it will not just be a rotten mess by the time it gets to our office. And so obtaining isopropyl alcohol at this point is very challenging. A lot of people are kind of buying that up. That makes it a challenge. And Sam mentioned the temperature checking, which is really interesting because we have what's called a FLIR camera that we obtained, I think, in April, and it's a thermal camera, and it will help us detect Asian giant hornet nests in the ground. So it's going to help us detect where they might actually be nesting. Well, we got one and we were trying it out, and we decided it was probably going to be helpful. So we put in an order to get, I think, 3 or 4 more, and we're still waiting. And this is actually COVID related because this is an expensive camera, and it's a very high tech camera that most of us would not want to pay for. But the little temperature things that can like point at your forehead and take your temperature, nobody can get those now. So they've been buying progressively more expensive cameras that can do the same thing. And now it's gotten to the point where they're buying these very expensive FLIR cameras, and there's a backlog. And so we can't get these cameras that we need if we are going to find Asian giant hornet nests and eradicate them. So there's a couple of things that have been challenging. On the isopropyl alcohol side, the backup solution is to basically salt the insects and mail them that way, but it's substantially less effective than using isopropyl alcohol. So we actually had a lot of brainstorming in the Facebook group of people of ideas of what else contains isopropyl alcohol that you might be able to use instead. And some people even came up with packages of sunglasses wipes from Costco that were actually 70% isopropyl alcohol. So there was a lot of creativity in the group there to come up with some solutions. So I don't think we're getting too many salted specimens, thank goodness, but it's definitely been an issue.
Yeah, thank you for that. So stop buying alcohol, clean with something else, because ag needs it. All right, Megan.
Yeah, so I'm kind of piggybacking off of Sam's comments, about, the business's role. A business that we worked with early on in our response was Tyson Fresh Meats. They have a beef processing plant in Wallula, and they, we really had to work closely with them for a facility-wide outbreak that we had, and they even though they responding pretty quickly and put a lot of great things in place, it did take time. But even now, we're still having cases there, even though the transmission within the workplace is very limited. However, what impacts that workplace is what people do when they go home. And that personal responsibility with COVID-19 is so critical and needs to be highlighted over and over again, because it's that personal responsibility that's really going to, for people doing the right thing when they are at home, when they are in social settings, which should be no more than like 5 people per week. But I think that's been something that's been really interesting to us, and it was a unique situation, or it was a tricky situation that we tried to find a unique solution to it, with working with Tyson and working with the employees and the employees union and everything. And it's just still been really difficult and wasn't an ideal. We still don't have an ideal outcome for that or solution.
Thank you, Megan. We have another question from a participant asking if the Canadian border closure has had a negative impact on Washington's emergency management operations or any other COVID-related response. So I don't know if anyone wants to answer that.
So I'll mention a couple of things just for exercise practices. The exercises that we had scheduled at Hanford earlier this spring, for example, were canceled. They had initially been looking at rescheduling them for August. We still haven't heard anything. So nobody's doing exercises because we're busy. Everybody in emergency response, I think, is still quite busy. On the Department of Ag side, the traps or the catches that we have for Asian giant hornet are like a stone's throw from the Canadian border, and there's actual detections on the other side of the Canadian border. So normally we would probably be doing a little bit of traveling back and forth, even though we'd be partnering with the Canadian authorities, which we are doing right now. But that ability to travel obviously is not there. And believe it or not, there's even a location of Washington that you have to travel through Canada to get to called Point Roberts. And you have to basically drive up into Canada and go around and come back down into Point Roberts. And the only way to get there is to drive through Canada. So that's another thing that we can't do for our trapping that we normally do out on Point Roberts.
Thanks, Carla. Either Sam or Megan, have you seen a negative impact because of the Canadian border closure?
I think maybe just the number of travelers have obviously gone down. The Canadian border closure, quite frankly, doesn't affect the port all too much. I will say, however, just as a side note, that coordinating with other airports in general has been a challenge because there hasn't been a federal mandate on, for instance, face masks, right? So, we as a port can do everything we can within the Port of Seattle to make sure that our travelers are wearing a mask. But what if someone from New York or Austin or LA or San Francisco doesn't get the memo and they fly into Seattle without a mask, right? And so then how do we deal with people who are coming into the airport and are unaware of the rules that we've put in place at our airport? And so this is why a federal response or a unified response across the country would make a huge difference. Because if every airport had a mask requirement, or if every airport had a temperature screening, or if every airport had a standardized procedure when it comes to safety, it would really help everybody collectively, and it would help with coordination and stuff like that. And that's the same for international as well. When people come in from Asia, we just don't have the same standards as some of the airports in Asia. So when we go over there, some of our travelers are caught off guard with some of their requirements. And so, this is not Canadian border specific, but just general response has been very fragmented, and given the lack of leadership we've seen on the federal level.
Thank you for that. I haven't specifically heard, since I am in emergency management, I haven't specifically heard of negative impacts, but I know there has been some related to supply chain, things traveling from Canada to Washington. All right, so the next question, we're going to start with Megan this time. Where do you see new intersections between sectors or with partners that you did not have a relationship with prior to the pandemic?
Yeah, so I think our newest kind of partner who we are really working with regularly on a daily basis is the Chamber of Commerce. You know, we have always been part of, you know, and even the Port of Walla Walla, and some of those, you know, that I've always attended like our economic development meetings and things, just because I'm very interested, and I know that, you know, our economic situation and businesses and within the community have a huge impact on social determinants of health and the interrelatedness there. I think now, though, you know, they're starting to reach out more to us and seeing us as a stronger partner as well. And I think that will be long lasting, definitely, because, you know, in all the work that we do right now, especially, is it's all about relationships, and establishing those relationships across sectors has been so critical, especially with our business sector. And the Chamber of Commerce has been really critical in you know, helping to facilitate and create some linkages with our department and businesses in the community, that I think has also benefited other work that we do. You know, we're a health and human services department, so we actually also, you know, oversee our behavioral health programming and developmental disabilities and homelessness, and so some of those partners will be and those connections will be really beneficial as we even move, you know, into the recovery side of the pandemic, and will be really long lasting benefit to our community.
Okay, so Megan, a follow on to that, have you seen an increase in who's paying attention to public health messages since the pandemic?
It's like everyone, especially those who don't or who disagree. They seem to really pay attention and to be really vocal. But it's, you know, I would say that those who are paying more attention to public health messaging right now, you know, are especially our employers and of like our migrant farm workers who, you know, who employ migrant farm workers. They're definitely paying a lot more attention and are inviting us out even to do, I wouldn't call them like a health fair in a sense, or an education fair with their employees. And so that's been new.
Great, thank you. All right, what about Carla? What new connections or intersections have you seen?
So I think for the most part, ours have primarily been strengthening existing connections. And just as one example, we're a member of the Washington State Invasive Species Council. And, you know, I don't know if this is COVID related so much as Asian giant hornet related, but we knew that this was going to be a very big issue and that we really needed to pull all of our resources together and unite our messaging around Asian giant hornet. That's just grown as we continue with Asian giant hornet. And one of the, I guess, new solutions that I have is that this is one of those things, much like COVID, where if you're sending out messaging, it has to be run by a lot of people. And normally it's just us, you know, normally not a lot of people take a lot of interest in agriculture issues. But with Asian giant hornet, I now have a communications distribution list where I send it out to everyone to make sure that those who our stakeholders have a chance to give feedback before we go out with messaging on Asian giant hornet. And we've just worked a lot more closely with some of our partners like the Department of Health. You know, I feel for you guys because working in anybody responding with the health issues, because there are some things where we've needed feedback from the Department of Health, for example, and it's really challenging for them just because they're so swamped with everything that's happening with COVID. But we have been able to get some things out that have been, you know, vetted by the Department of Health, which has been really, which has been great. We've worked a lot more closely over the past few months, I think, than we have in the past. But one area where we've really sort of expanded, I think, and that's with the news media. So we had, you know, as I mentioned a few times already, you know, agriculture is sometimes kind of a hard sell to the general public, but Asian giant hornet is not. That sells itself. And so we've had a lot more interest with the news media, and then continued followed up interest, especially, you know, a couple of weeks ago, I started having all of these contacts again. I was like, I must be on some sort of 2-month follow-up from these national news media outlets, because everybody's contacting me again 2 months later to find out what's happening with Asian giant hornet. But we're able to start some actual kind of relationships with both national and even more local reporters to continue to build off that in the future. And I've been able to say, hey, you want to stay informed about what we're doing here? You know, sign up for our pest program updates, sign up for our news releases, sign up for our blog, and you can learn about what we're doing. And a lot of them have taken that opportunity to sign up to get that information, because I had a lot of people saying to me, yeah, just let me know when something new happens. And I was like, I've got like hundreds of people here that want to be notified if something new happens. I can't send you all an individual email. So here's where you can sign up if you would like to be notified, and we'll be sure to send the message out to everyone. Of course, you don't want to slight somebody too by forgetting to send it to one news organization and not the other. So it has been really good to work with the news media and build on those relationships. And that brings to mind something else I probably should have mentioned it under another question, but a new solution was that we held our first ever virtual press conference, which was pretty scary for us. I've worked here for Department of Agriculture for 5 years, and we've never done a press conference at all. And so our first one that we've done since I've been there, at least, was a virtual one, and we had never used the technology in that way, and there was national attention. And so you know, it was a little bit scary, but I would say, you know, just sort of as a piece of advice, you know, jump into that scary water, because when things first hit in May, we thought about doing a press conference, but didn't do one because of like the technology issue. People hadn't been working from home that long, weren't sure if their internet connections would work very well. And we literally spent an entire week responding. There are about 3 or 4 of us that basically did nothing but respond to media requests for an entire week at the beginning of May. When we had our first new detection a couple of weeks after that, in I think it was at the end of May, we decided to go with a virtual press conference route. We held it. After it was done, I had like 2 follow-up questions, and that was it. And I was like kicking myself for not having done the press conference in the first place, because it saved so much time, not only for me, but for all of our subject matter experts that were being interviewed repeatedly with the same questions. So if you haven't tried a virtual press conference yet and you think you might need one, go for it. That's my advice.
Great, thanks, Carla. We do have a couple of questions, but I'm going to ask Sam to speak first about new connections or intersections, and then we'll.
Yeah, thanks. I'll make mine quick. I think we touched upon it real briefly before, but I mean, again, we're not a public health agency, right? And so just having to deal with the State Department of Health as well as King County Health to really figure out who's going to do what in terms of safety and screenings. And so we are getting involved at a level that we're not used to when it comes to that. And then from a trade and logistics standpoint, just working with our private sector partners and keeping coordinated. I mean, we have really great relationship with all the airlines at the airport, and that's not a new relationship, but the healthcare screening stuff and COVID-19 has really, I guess, elevated the level of, involvement. We're all talking to them just about every day, just to get a sense of numbers and recovery and stuff like that.
Thanks for that. Also, to all of the panelists, there's a question that says people are wearing different types of masks with no standardization, everything from homemade to stretchy masks, paper mask, bandanas. Do you see a need for a standardized requirement for what is acceptable and what is not?
I think the biggest thing with masks for the general public, who are going to the grocery store, who are going to the post office, things like that, is that, they wear a face covering that fully covers their nose and goes all the way down over their chin. And so it needs to fully cover your nose and mouth to limit any droplets. And so I think that's the biggest thing the biggest, inequity, I guess, or inefficiency of masks or face coverings that I see. But, the general person that you're just going to the store or just out and about, doesn't need to wear like an N95 mask. We really need to be saving those as much as we can for our, our EMS workers and healthcare workers and things like that, or, who need that level of mask. Some are, and that's fine. But I don't think that, for the general public, I don't have it right here. I wear a mask that's, it's made of cloth and it has a little filter in it, and it works perfectly fine. It catches any droplets from going on to anyone else. And so it protects others from anything that I may have and not know about. And so I don't think that we need anything, that, that would be, more standardized across the board. I think the more we get to there, then we'd have more supply chain issues with face coverings.
I would echo that sentiment. I think the challenge is that we're having trouble just getting people to wear masks, period. There's also an issue of, if we did designate a certain standard of masks, do we even have the supply in the market for everyone to go and buy those masks? If so, and all of a sudden demand shoots up for certain types of masks, there's price gouging, and also this question of equity, right? Like, some people might be making masks out of an old t-shirt because they can't afford to replace disposable masks every week. I mean, we got a huge unemployment number of people who may not have discretionary income to go out and buy disposable masks. So I think there's a lot of factors here, and it would be really difficult for us to, it's hard enough to enforce a mask requirement, right? Again, I asked the question of, what can we do if someone decides not to wear a mask, right? Do we throw them in jail, right? But it would be even more difficult to enforce a standard of face covering. In fact, at the Port of Seattle, our policy is not a mask requirement. We call it a face covering requirement. We're very careful about the words we use because it has different implications for different people. And then the last part I'll just say is that there are people with health conditions that may make it difficult for them to wear a mask, whether it's respiratory or other health issues. And so that's also a unique challenge where certain masks don't work for some people because they might be too thick and they can't breathe or whatever. And so I think it's a very, very complicated issue and I think there's probably a huge spectrum of perspectives here. But from an execution and practical standpoint, it would just be so difficult for us to agree upon the standard, but also just implement that standard.
Okay, thank you. Carla, did you have anything to add about masks?
I'm staying in my lane.
Okay. All right. So there was also a question when you were talking about dealing with businesses. Can you say a little bit more, any panelists, about conversations with businesses and how you stay apolitical?
I guess since I deal with the businesses the most often, I can answer that question. I think at the end of the day, businesses are concerned about their bottom line, and especially businesses like the airlines. They're hurting, and they're looking to cut costs everywhere. The other side of this is concessions, and what we call airport dining and retail, right? So all the restaurants at the airports. You know, there's never been at any point during this pandemic a discussion about, you know, well, the Democrats are doing this or Republicans are doing this. I mean, for the most part, the conversations have always been about, okay, how do we help each other here? And generally, when you talk about, you know, what's good for our tenants, like the airlines and our retailers, is good for us. And so we've basically seen a pretty strong alignment on, you know, on priorities. You know, if our tenants can't pay their rent and they default on rent, that's bad for us too as a tenant, as a landlord. And so as far as, you know, keeping things apolitical, we have not, I mean, we do not advocate on behalf of the airlines either. When the airline asks for a bailout, the airport does not weigh in on that stuff, right? And so I think there are very clear delineations between the private sector on us where we don't touch things that they're working on or lobbying for and vice versa, but we do coordinate on things on where our interests are aligned.
I'd say working directly, you know, in consulting. I mean, ultimately, that's kind of been the role that we've been in, is consulting with businesses and helping them kind of interpret the governor's plans and guidelines. It has been to keep things really simple. We keep it simple. We stick to pretty much, you know, as black and white as we can. There is so much gray in all of this that we really try to just keep it simple. And if they're really, you know, frustrated with something, or they just don't understand something, you know, we say, well, you know, this is how we interpret it. However, if you have any additional questions, you can call Washington State Department of Labor and Industries. And so, you know, I think that's, we don't have to do that very often though, because I think that, like echoing what Sam said, you know, we're all in this together and we're all wanting to do what's right for, you know, our friends, our family, our community, our state. And I think that that's something that, you know, where it, you know, it doesn't matter what party you're affiliated with. And I think that's been something that, you know, that's where we try to really keep it. And then we also try to kind of even keep it simple and keep it not necessarily personal, but just thinking about, you know, like, well, why wouldn't you, you know, kind of keeping it like as, you know, non-political as possible, is like, really, let's just talk about you and I. You know, when you're talking about you and me and two people, it's not very political. And so that's been, you know, really focused on the relationship and keeping things simple is where we've tried to steer things. And then when nothing else works, we just send them to the state. We haven't had to send anybody to the Department of Ag yet though, so, or the Port of Seattle.
I'm just waiting for it.
Okay, we have another question for all the panelists. What are other systemic vulnerabilities you are concerned about, such as funding or other resources where you think your organization may be stretched to capacity as if we have another wave or the current COVID situation continues?
So this is Carla. I'll go first on this one. I'll just say we're already stretched to capacity. The economic downturn affects not only businesses, but government as well. Probably everybody knows that state workers at least have been furloughed 1 day a week for the month of July, and then 1 day a month for the rest of the year. There are a few exemptions to that, but it applies to really almost everyone. And that's a real challenge. For example, our going back to our trappers, these are seasonal trappers that are only hired for a certain amount of time. They have a certain amount of work to do that has to get done in, you know, by the end of September. And so having less time to work with, or if they have supervisors that have less time available to work, that is a serious challenge. And with, you know, the continued economic decline, we may not have the staff available to address these important issues. And I speak a lot about invasive species because that's what I work with the most, but there are a lot of other things that Department of Ag works on, but invasive species like Asian giant hornet, the thing about invasive species is you have to hit them hard when they are first introduced. You can't say, well, we'll get that next year or in a couple of years when things look better, because by that time they've established, and instead of working on eradication, now you're working on mitigation and trying to just manage the numbers rather than getting rid of the problem so you don't have to deal with it in the long term. So those are the kinds of things that we're trying to juggle at the Department of Agriculture, as I'm sure everybody else is, trying to get the same amount of work done with fewer people or fewer hours. It's a challenge, and I kind of laugh because I'm technically exempt in my position, but because I've been furloughed, you're no longer exempt. So I usually work more than 40 hours a week, but I'm restricted to 32 hours a week and no more. So they're losing more than 8 hours of work from me because of this situation. So I'm able to get even less than normal done in my own personal job. So people are slower to respond, and the longer that this continues, the more that's going to happen, even on a government level.
So I'll just add by saying that the budget implications are astronomical here. I mean, I'm sure Curry and others will agree that there's been a huge drop in revenue from people, staying at home, not spending money. So cities aren't getting the sales tax revenue, unemployment, and at the port, obviously, there's a lot less people traveling. So we don't receive the landing fees that we normally would anticipate and stuff like that. And so the Port of Seattle actually received $192 million from the CARES Act, which was extremely helpful in dealing with our $250 million budget shortfall that we're expecting here. So we still have about a $60 million hole that we're digging ourselves out of by cutting certain things. But aside from that, as far as I'm seeing some stuff on the chat about communications, we've really adapted our communications to be a little more rapid. And so instead of being dependent on email, we would use platforms like Slack or Asana, or even sometimes just texting each other a little more to get rapid responses, right? Sometimes emails are slow because your email inbox gets flooded and you're not really sure what to respond to quickest. But we found that if you adapt by using some of these platforms like Slack, it helps a lot. You can create groups that are specific to issues or specific to functions. And when you text the entire group, you know that people, you get notification, all that stuff. So that's the level of adaptation that we're making here. And then the other thing that we're doing is we're spending a lot of money on stuff that we traditionally don't spend money on, right? So we spend money on temperature. I think it was Carla who was mentioning that some of these temperature screening hardware is really expensive. Those are, and all these other, like the plexiglasses that go up on the kiosks. We have over 200 sanitizing stations at the airport now. These are all expenses that we never really anticipated. And so we're actually working to try and get those stuff reimbursed by FEMA and DHS and TSA. I highly encourage other jurisdictions to try to do the same thing. We literally apply for a reimbursement with FEMA because we consider this to be an emergency situation. And then we're obviously constantly lobbying the federal government to allow us to get those reimbursements, because all that stuff really contributes to some of the budget shortfalls, and the budget shortfalls contributes to some of the holes we may have in security. So that's kind of what we're dealing with right now.
I'd say from our perspective with public health is, of course there's a fund, there will be in the future funding. Public health is, we've received a decent amount of funding right now actually, but it really is only covering our communicable disease response to COVID-19 and supports for isolation and quarantine. So really it's management and mitigation of the pandemic to reduce disease activity. But long term, funding impacts either to the state level or even local level, like what Sam said, are going to be long lasting. And those will impact our department, of course, but then also I think something else that we're looking at is like those, outside of funding are the individual funding impacts that our community members have seen, and how we are now, we've seen a huge increase in our rental assistance enrollment to help with that, an increase in the food banks and usage there, increase in utility assistance. I mean, all of those different areas. And so I think that seeing, the impacts there are going to be long lasting as well, well after the pandemic, and that, response and recovery from COVID-19 is going to be, so critical there. And then also, thinking about another area of systematic vulnerability is our behavioral health system, and how, we've seen about a 50% increase in the number of individuals succumbing to suicide within just Walla Walla County since the beginning of the year. And although it can't be, linked directly to the pandemic, the number of overdoses and the amount of alcohol and marijuana sales have increased substantially from previous years. And so, we're going to see, a whole nother additional exacerbated pandemic, with substance use and abuse and mental health related to this as well, that we are not equipped in Washington State to respond to.
Thank you. I think we're probably not equipped for mental health in the way that we're going to see it in a lot of places. Thank you for that. The funding for local government is all based on taxes. So anytime people don't spend money, go to restaurants, buy things, then local government also has a shortage from that. And of course, increased expenses. So we have a few more questions. Thank you, participants, for being patient. So Kirsten asks, what were the most important pre-COVID or pre-Hornet relationships or mechanisms, practices you had in place that helped set the foundation for then what you had to do during response?
I'll just say that I think that, the Port of Seattle has a very strong government affairs and government relations department, as do most municipalities and agencies. And I think being able to articulate the situation on the ground to our congressional delegation and to our governor was crucial. And being able to articulate to Jay Inslee and Maria Cantwell and Patty Murray and all the other congressional representatives we have in DC, this is what we're seeing. And this is what we need to do, especially in the absence of leadership from this presidential administration. And I don't want to get political here, but there truly has been a staggering amount of just reluctance from the presidential administration. So we've really heavily had to rely on our congressional delegation to get the $192 million in CARES Act, to really try and figure out, how we can coordinate with the folks on the federal level to make sure that we're doing everything we can on safety.
So I'll share a couple of things. One thing that we had in place, I think, is really important is training. So as I mentioned, I think in my introduction, I've done quite a lot of the FEMA and emergency response trainings and exercises, and like participated in Cascadia Rising and that kind of thing. All of those experiences and trainings really helped for being able to respond not only with Asian Giant Hornet, but I spent 4 weeks in the Joint Information Center when the lockdowns started happening in Washington. And so I know nothing about public health, but the communications training and experience allowed me to step in and help at the Joint Information Center at Camp Murray until Asian Giant Hornet took over my life. So training, I think, was really critical. for Asian giant hornet specifically, we already had, before things got crazy, a lot of good things in place. So we had specific areas in our website developed for Asian giant hornet. We had a short URL developed. We had a lot of communication already happening on social media. So when we had photos, so we already had a lot of information and resources readily available for folks. So having that out there and available in an online fashion really made it easy for people to find information, as well as for me to share it to those who were looking for it. And then lastly, one of the things we had in place is that we've been really pretty active on social media, working on building our audience to the best of our ability, given our parameters that we have, for several years. And so when I started in 2015, I think we had like 2,000 maybe followers on Facebook, and now we're up to about 40,000. So social media is so critical when you are communicating in a crisis. Everybody's communicating on social media one way or another. It's really important to be on there and be part of that conversation. But if you haven't already consistently built up that conversation and been listening to people online, been responding to their questions and their comments, getting people that are interested in following you, nobody's going to hear what you say during a crisis, because they're not following you, they're following somebody else, they're following their friends. You never show up in their news feed. So you can pay a lot of money, I guess, which we do that too, but well, not a lot of money, some money to promote posts, but having that regular, consistent, engaged voice on social media all the time is critical, so that people can know and hear you during a crisis.
And I'll just add really quickly, echoing training and those, partnerships with our congressional representatives, both state and or local and state, and partnerships with the Department of Health is our partnerships and training that we've done with our local healthcare system, and our emergency management system has been so critical and really allowed us to pretty much dive in head first. It wasn't a think about it situation with our first case. We knew it was coming. However, nothing really prepares you for that first call of a potential COVID-19 case in the emergency room, when all of the testing had to be approved by the local health jurisdiction at the time to go to Department of Health. And so I think having, we're in a bullet assessment hospital here in Walla Walla County, and so having all the special pathogens training and tabletop exercises and things like that we've done have been really critical. And I think that also it's also really really nice to know that the plans that we have work, which is really great. And it is nice to know that the continued investment in public health preparedness and emergency management and communicable disease preparedness is so critical.
Okay, thank you. So another question, and just wanted to let the participants know that if we run out of time, we are tracking all the questions and we will get you answers by next week. So another question: what long-term impactful changes post-pandemic do you see to agriculture, to air travel, especially business, and any other supply chain changes? And then how do you see that discussed trend to nearshore, onshore manufacturing affecting the port in the long term? So first to everyone about kind of supply chain issues, and then more specifically for the port.
So there's a few things here. One is that if we continue to work at home post the pandemic, and so let's first go over some assumptions. Let's assume there's no vaccine yet, but we've gone past we're past the pandemic stage where we've sufficiently flattened the curve, and we've opened up a little bit. I think that there will still be a large part of the workforce that continues to work from home. Offices will likely rotate in employees. So instead of everyone coming in every day, you'll have certain subsets of employees coming in 2 or 3 days a week, and then rotating in. So, due to social distancing and all that stuff. And so that's kind of what I expect post-COVID. From like a supply chain and construction point of view, I think there's also a few things here. First, generally, I think maybe demand for certain products and things will go down. That's what we saw when COVID first hit us back in December, and throughout. When you're staying at home, you just don't consume as much. I don't know if you all have realized, like I'm spending a lot less money going out. And so I think that overall consumer demand will go down, which will then affect our import and export numbers. But the really fascinating part about this from like a construction and capital project standpoint is that initially when COVID hit, we thought that the cost of construction and supplies and materials would go down because of a lack of demand for the products and the services. But what we found is actually cost of construction, materials, and everything has gone up. And the reason is what we call the COVID premium. And that is, with social distancing as a requirement, if you can think about, a construction worker putting up rebar, what would normally take 2 or 3 people working in one area on a job site, now they can't do that, right? You can't have 2 or 3 people working within 6 feet of each other on a project, right? And so because of the social distancing aspect, projects are becoming far less efficient because you can't have as many bodies on the construction sites. And so what's happened is instead of it actually becoming cheaper, it's becoming more expensive to do construction because of the social distancing, but also the requirement for PPEs. So all the hand sanitizing, all the cleaning of the job sites and the masks, those are all added premiums and costs to construction and capital projects, which are then being passed down to us. And so that's kind of what we're seeing here is what we call the COVID premium, for lack of a better term. And, until we get a vaccine, and, even if we get post-pandemic levels, right, as long as COVID-19 is still a threat to us, I think that it's safe to say that we're going to experience the same level of inefficiency, as I would call it. And this goes for the airlines too, right? You have 3 seats to each side of the plane. You can no longer have that person in the middle seat, at the very least, with social distancing. I think that economics and the numbers of the financials of airlines will fundamentally shift. Airlines only make money on scale and as packing as many people as you can onto a plane. And when you limit an airplane's capacity by 60% or 50%, you're really messing with the metrics, the economic metrics and the scalability of an entire industry. And so I'm really curious to see how airlines are going to adapt. They may have to upgrade to a bigger plane so you can provide more space between passengers. And so that's another thing that I see that might fundamentally change until we have a vaccine or we achieve some form of herd immunity.
So the question repeated, what long-term impactful changes post-pandemic do you see to agriculture or other parts of the supply chain?
So I don't want to speak for all of agriculture. As I mentioned, I kind of have a bit of a narrow focus, but there are supply chain issues, but there's also demand issues. So agriculture is highly dependent on exports in Washington state. And so, there's not as much leaving the state. And that's a problem. Just as one example that I know of, potatoes. We export a lot of potatoes in the form of French fries usually, and those are not going out. That I guess that's both locally and internationally. There's a lot fewer people eating in restaurants, a lot fewer French fries being eaten. You can have your own opinion about whether that's a good or a bad thing, but for a potato farmer, it's not so good. And as many of you may have seen, there have been, the Washington State Potato Commission had a 1 million pound potato giveaway where they went around different areas of the state and were just giving out bags of potatoes. And that 1 million pounds was a fraction of what they had to get rid of. Potatoes are basically stored in big, huge barn kind of things, storage sheds, and they're pulled out as they're needed for processing. Well, nobody's processing. We've got full potato sheds and new potato crops that are ready to be harvested at this point. So we have a stopgap on the other end where there's no place for a lot of agriculture to go. If you are, you know, a typical, I guess you might say, farmer, if you're a small scale farmer, where you are doing like community supported agriculture and doing CSAs, those people have actually seen, you know, an increase in demand, or people trying to get, you know, more locally produced fresh produce. So it depends upon what type of farm you are, but as far as a percentage of, you know, agricultural sales in Washington State, the small direct farm sales are, you know, microscopic compared to the international exports and the other, you know, sort of like mass produced, I don't like, well, large scale farms that are, you know, growing hundreds of thousands of pounds of potatoes or wheat or whatever the case is. We're just so dependent on exports in agriculture that there's going to be, there already are impacts, obviously, but that I suspect is going to continue and sort of exacerbate itself.
So we're getting to the end of our time, and so I don't want it to cut us off. First of all, thank you for that answer, Carla. We will provide answers to the rest of the questions that were in the Q&A, and also if Megan had additional things about supply chain, we will also provide those in the things that we sent out to everyone. Before we sign off, I did want to thank the participants. Thank you so much for joining us today. I appreciate it. And all the participants that also were able to listen in, that's wonderful. Just quickly, 30 seconds or 20 seconds, any of the panelists have a closing comment they'd like to share?
Stay safe, everybody.
Wear your masks or face coverings when out in public.
Eat your French fries.
That's
you.
great. That's my favorite. All right. Thank you so much again to all of you for joining us and all the participants on the line.